All right, welcome back, everyone. So, Prime Minister Andrew Holness, as many of you already know, if not, you should, he's announced new measures aimed at containing the spread of the coronavirus. Meanwhile, there have been 80 new cases, bringing the overall case count to 3,183, with 2,096 of them active as of yesterday, Monday, September 7. To tell us what's happening, we're very lucky to have with us Dr. Karen Webster Kerr. I can't imagine how many hours she now has in her day. She's National Epidemiologist and Principal Medical Officer at the Ministry of Health and Wellness. Good morning, Dr. Webster Kerr.
I think it's a good question to ask how you're doing. How are you doing this morning?
All right, we seem to be having some audio issues here in studio. I'm not sure if our listeners are hearing Doc at the moment. So until that's addressed, just reminders. Doc, I think your mic is muted. I think that's what's happening. So if you can unmute and rejoin us.
Okay.
Because we were hearing her off air. I think that's it now, Doc.
No, I'm not muted.
Okay. We are hearing you very clearly now. Thank you so much. First question we were asking was, how are you doing?
Yep.
All right, let's see if we can fix that before.
Gremlins this morning.
Yeah, let's see if we can fix that before we bring that back on. So, COVID measures, for those who don't know, we did mention them in Hot Topics. Curfew hours 8 to 5 a.m. So a little bit, an additional hour. Well, from last week because they're gone to 9, but now 8 to 5, reasonable. Corporate, we still don't have to wait on the Prime Minister to do work from home.
Work from home, yes. That's a big discussion right now, is more people want to see more entities effect work from home orders. The Prime Minister did say yesterday that while there's no mandate per se, he has explicitly said that organizations and corporate entities that can allow staff to work from home should do so. So, let's not wait until something goes wrong inside our workplace to try to institute those measures. We have to be smart about it. And since the virus moves around where a lot of people are, it would seem like a no-brainer, right?
Yeah. And look out for each other. I mean, sometimes I'll be driving in the car. I know people drive with the mask on. I don't always drive with the mask on. And I'll step out and say, oh, I don't have my mask on. So look out for each other. If you see somebody and say, hey, wear your mask, man. Or, because I see whole heap of people still walk around without their mask. If them have the vaccine, and if they do, why don't they share it with the rest of the world? Because why would you not be masked? Especially young kids. I see adults walking with their children and they don't have them in masks.
Well, there's a notion, that needs to be, there's several areas that need to be addressed with this thing. And I heard you say something that I think is very critical, Delia. And you would have been speaking from a behavioral change expert perspective, right? Until I think we start to see testimonials of people who have gone through this thing, who have gotten a beating from this thing, and who, God bless him, lived to tell the tale. A lot of us won't understand. It won't come home to us about how we can be affected by this disease. And so, a lot of us think that children don't get it. Really bother the children, and the children don't really get it so bad. So, they're not really at risk.
Yeah, it really is a problem. All right, so we're going to join Dr. Karen Webster Kerr via phone.
Okay.
And see if we can, get a better connection. Doc?
Yes, morning again.
Morning to you. Our apologies for that. While you were fixing the technical stuff, though, Simone and I were having a discussion, and community transmission. It's one of those terms that we're now hearing more of. I don't know if everyone understands in the context of COVID-19, what does that mean? Can you just break that down a little bit for us?
So it means that anybody could possibly have COVID. So there are persons who may have flu-like illness appearing to hospital, health centers, private doctors' offices, and are tested positive for COVID. And who we have is just a tip of the iceberg. So within the community, COVID is spreading, and anybody could have it.
Okay, so we're not talking about airborne, right? That's another level.
No, we are talking about droplet spread and contact spread.
Okay.
So the coughing, the sneezing, touching your face and touching some object, light switch, etc., and somebody else touching that and touching their face and nose.
And droplets lingering in the air for a while, right?
Can be
yes.
what they call aerosolized, but it's usually in a medical. Say, for instance, you're nebulizing somebody, or you're what you call intubating somebody. So it's usually in a medical setting that it would be aerosolized.
Yeah. I think the challenge for your team is when you're able to contact trace, it's a little bit easier to contain, because at least you know then this is patient 0 and he may come in contact with these 12 people. But for the community, you just have no idea who may or may not have it. I guess that's why they're saying assume that everybody has it, right, Doc?
Yes, we have to assume everybody have it. Family members, co-workers, church brother, church sister, everybody have it.
Yeah.
Well, Doc, we spoke about a story this morning where the Minister of Health, I heard somebody ask him at the conference yesterday, I hear there's been one reported case at X. And he said, you know what, at this point, it don't even make no sense to talk about one reported case because it's going to become the norm. This morning in our Hot Topics, we spoke about the fact that we don't reach the peak yet, Doc. We're still going to climb.
Well.
Oh, okay. Doc is not hearing us. All right. So until we sort that, I'm going to talk about this issue.
I also saw, and they did say the minister had already said it. I might have blocked it out of my consciousness, but he probably did say it, and I probably saw it and said, no, minister, that couldn't be. I'm saying at least 1.5 million.
He did.
Which is half of our population.
He did.
Will have it.
He did.
No, the thing, the conversation that I keep hearing is people saying, oh, but people have it, and but you don't know if you are going to be the person who has it and you'll be okay. I was using Chick-V as an example when I said there are people who've had it and now they're fine. The yen diesel up step strong and beautiful.
Sometime.
Well,
Sometime.
Chick-V, I don't know what's going to come next. One time it was the wrist. It was a short-term memory. It is the ankles, is the knee.
Auntie Faye will tell you the same thing.
Some people have had to have surgery.
I know.
Because of Chick-V.
I know.
So you don't know how COVID is going to affect you.
Yeah.
It may be asymptomatic in one person.
Maybe mild and it may be chronic.
Maybe chronic.
Which
you
is
never
why
know.
You don't need to find out, is the point.
Yeah.
So you need to be as careful as you can in protecting yourself. And if indeed it is that, this thing is going to get even worse, as was reported, we have not yet seen the peak. Another 3 months, they're saying, before we can see the peak and the eventual decline. That is frightening to think about. But it reiterates that we need to do what we can do. It is our responsibility. Government can do so much. And no more. They can tell us what to do, and we can still go to the door without the mask and still be on top of each other like this. It's not going to change.
Not going to change. All right, I think we have Doc back on phone. Doc?
Yes.
All right, so I'm not sure if you heard a little bit of the chit-chat Simone and I had, and Simone raised the fact that we're not yet at the peak, and that figures have been around, at least 1.5 million. What are we really looking at in terms of just how widespread this thing possibly can be?
So what we expect is it will be all across the country. Right now, active cases are approximately 40% of all communities
Wow.
have active cases right now.
Wow.
So the peak we expect probably in another 4 weeks or 8 weeks. We noted the inflection point, that's where we're going to call the peak from, around the 8th of August, but it takes a little while for us to recognize there is that inflection point and the sharp rise in cases. So the 8 weeks would have started then, so we possibly looking for another 4 to 8 weeks for the peak. It's if we do nothing, we can make the change to decrease what the peak could be, as well as to make the descent quicker.
So you're saying that four more weeks to the peak is if we just don't change our behavior, but we can actually mitigate and get to that point earlier and break the back of this increase if we do what we ought to do.
Correct. So we can
See that?
decrease the peak, which is, it may not decrease the descent or let the descent come faster, but at least it will be at a lower level and more manageable.
Okay, so 40% of communities know, all communities you're saying have
Right.
COVID-19. If this thing gets to the peak, what numbers are we looking at, anecdotally, Doc, in those communities, same communities?
So we expect it's traveling in many communities. So we look at probably the last 2 weeks, the communities involved.
Doc, one of the things that I want you to, and I hope you can assist me with this, is what should the public do? Had a recent situation where someone said, I feel like a relative of mine may be COVID positive. But it was almost like, where do we go? What hospital do we go to? Do we go to the private doctor? Do we go to the public hospital? Is there a test that's done privately? Are all tests done through the Ministry of Health? Can you assist me with some of those answers?
So most of the tests are done within the public system, but you can access it through many different means.
Okay.
You could access it, your doctor could call the health department, the parish health department, could do the Jam COVID site, as well as if you're into the public system, you can access there. But as we go along, the 1.5 million persons is over a year, and many persons may be asymptomatic, mildly symptomatic, and then so you won't know. What we have is a tip of the iceberg.
Wow.
And so everybody have to be careful. Not everybody will be tested because you may never know. That's why you have to suspect everybody have COVID and everybody take protection.
All right, Doc. Want to thank you so much for speaking with us. I know everybody at the Ministry of Health and Wellness, they're working 36-hour days, and we truly are grateful for all the work that you guys put in.
Yeah.
Yeah.
Second that.
Thanks.
Thank you,
Thank
Doc.
you.
Dr. Karen Webster
Bye-bye.
Kerr, National Epidemiologist and the Principal Medical Officer at the Ministry of Health and Wellness.
So it's also World Physiotherapy Day, but how are physiotherapists helping people to recover from COVID? That's next. So please stick and stay. We'll soon come.